My name is Mariam. My husband's name is Guli. It hurts to experience the pains of childbirth and not see the baby. When I was in labor, I visited a traditional birth attendant who could not manage my condition. When things got bad, I was rushed to a primary health care in my community. I was unconscious when I arrived at the health facility. The nurses struggled to save my life. I survived, but I lost my baby. I was given medicine to help me recover. I am lucky to be alive and getting better gradually. Never again should a woman go through my experience and lose her baby.
With a fertility rate of about 6 births per woman, Nigeria accounts for almost 6 million births annually. This is the 3rd highest number of births in the world, behind India and China. According to Saving Newborn Lives in Nigeria, a Federal Ministry of Health report, nearly 1 million children before the age of 5 die every year. Of these, 241,000 are babies under 28 days. This translates to 700 babies every day, 30 babies every hour. By the time you finish watching these, 8 babies would have died. Many deaths occur at home and are therefore unseen and unaccounted in official statistics. Many of the children do not live to be named.
When we are looking at the newborns and their health, I would say that their health is abysmally low. We in Nigeria, we have not paid enough attention to the newborn people. That's maybe because they are newborns and they have no voice and they have no advocates.
With about 70% of her population living on less than $1 a day, Nigeria has the highest number of newborn deaths in Africa and the 2nd highest in the world. While antenatal care is essential to improve pregnancy, care during childbirth and within the first week of life can prevent majority of newborn deaths. 6 in 10 women receive antenatal care, but only 4 in 10 give birth with a skilled health worker, and in some states that number drops to fewer than 1 in 10 in many other states, particularly in northern Nigeria. Newborn care often receives less than optimum attention in urban Nigeria and much less in rural Nigeria, where majority of the population live.
The problem of neonatal mortality actually starts from the antenatal period. The mother carries the pregnancy for 9 months, and along the time there are a lot of things that can happen that can affect that baby when that baby is being delivered.
There is a lack of understanding and underestimation of the severity of newborn deaths in Nigeria. This is because of the lack of visibility and voice of this vulnerable but critical group. There has been poor focus on newborns, hence inadequate provision of interventions and services for newborn health and survival. Lack of equipment and supplies, as well as trained service providers, contributes to ill health, death and disability in newborns.
We dwell on building superstructures at the city centers. This may not address the health needs of our society easily. You have to go down to the lowest level. And the rural ambulance service scheme is one way to do it, because they go from door to door, from village to village.
It is instructive to note that majority of newborn deaths are preventable. Major causes of newborn death include infections, difficulty in breathing at birth, and being born too early. All of these causes of death are avoidable if essential interventions in existing health packages reached all Nigerian women and newborns.
Government needs to first of all increase the health budget so that we can make services available to the very poor people in this country. They deserve to have access to services and quality services for that matter.
Quality services require health workers who are available to take care of mothers and newborn babies. Catherine Ojo, a Nigerian midwife, recently won the International Confederation of Midwives Awards in South Africa.
I'm asking for more midwives in Nigeria so that midwives who are very skilled and whose capacity has been built, especially in the area of neonatal resuscitation, life-saving skills, are actually posted to the rural community where they are needed so that they can be at the forefront of fighting this maternal and neonatal mortality in the community.
In 2007, Saving Newborn Lives project of Save the Children, funded by Bill and Melinda Gates Foundation and other agencies such as JAPICO, the WHO, UNICEF and UNFPA, in collaboration with the Federal Ministry of Health, developed a roadmap for delivery of key cost-effective and evidence-based interventions for newborn health in Nigeria, featuring written commitments by partners.
A lot is going on today and people are very interested in the politics. How can we link anything to do with child survival to that? It should be a voting issue. Almost 1 million Nigerian children die every year, 241,000 babies. It should be a key issue. Then what about people and champions? And this is critical. You are the people, you are the champions who can take this forward.
This report focuses on state-level data and critical coverage, equity and quality gaps for reducing maternal, child and especially Nigeria's 241,000 newborn deaths, which until recently have been neglected. And there is massive disparity across and within states. As a signatory to the world's commitment towards the Millennium Development Goals, the MDGs, especially Goals 4 and 5, Nigeria has a commitment to improve maternal and child health. Nigeria needs to set evidence-based priorities, invest in implementation, and be accountable for change and better life for her citizens. Save the Children is working with the federal and state ministries of health and local governments to advance newborn health. The organization is committed to partner with governments at all tiers for policy change that will benefit mothers, newborns, and children. This policy change includes ensuring improved access to health care for all, especially women, newborns, and children.
We have, as a government, made various commitments that need to be followed. Right now, these commitments are demanding some certain decisions and activities on the part of the government of Nigeria.
Also, the organization is promoting the rollout of high-impact essential interventions such as helping babies breathe and kangaroo mother care for low birth weight babies to survive. To secure Nigeria's future, every effort and all hands must come on board to help save the lives of mothers and newborns. As the deadline for reaching the Millennium Development Goals draw near, efforts must be accelerated in reducing these deaths, which is a critical step to Nigeria's progress towards the MDGs.
The most precious resource that Nigeria has is its children, and that starts from the first day of life. Children and newborns are even more precious than oil. We need to ensure that pregnant women go for their antenatal care, but also that they are looked after by trained birth attendants.
Save the Children is ready to work with all stakeholders in ensuring the advancement of newborn health. For the sake of Miriam and millions of other Nigerian women, please support the Ministries of Health and other relevant stakeholders to provide hope and succor to these women and babies. We count on you.
We love newborn, we love newborns. They come wet and get cold and get hungry. So we almost tell them, wash your hands, keep them dry, keep them warm and breastfeed them.